Right, hello everyone. Thank you so much for taking the time to join the webinar today. My name is Rosie and I work in the examinations department here at the Ophthalmology Foundation. If you have any questions throughout the course of this webinar, please feel free to drop them in the Q&A box at the bottom of your screen and we will get to them at the end during our Q&A portion of the webinar. So just for a small overview, the Ophthalmology Foundation as a whole aims to improve global healthcare through education, especially in under-resourced countries. It has been in operation for the past 5 years now. We run several programs in education, in fellowships, and then our latest initiative, which is our examinations that kicked off in March of this year. It's very much an international organization. We have a board of directors from all parts of the globe, as well as our dedicated examinations committee, again, which is global organization and team. So just to start off with, it would be great if we could run through introductions here from our panel. So Nicola, if you wouldn't mind introducing yourself, please.
Thank you, Rosie. My name is Nicola Quilter, and I'm the Examinations Director for the Ophthalmology Foundation. And I come with 20 years' experience of ophthalmology and exams.
Vicky,
Hello, my name's Vicky, and I'm an examinations administrator for the Ophthalmology Foundation.
Richard,
Hi there, I'm Richard Bowman. I'm a paediatric ophthalmologist in London, and I've been involved in setting ophthalmology exams for a good number of years as well with different boards. And I'm currently on the committee and responsible for the clinical paper, which I'm going to talk about briefly later on.
thank you. Dr. Ahmed.
I'm Dr. Ahmed Mohammed. I'm the coordinator of the examinations here in Sudan, at Sudan Eye Center.
Thank you. And then finally, Professor Kamal, if you wouldn't mind as well. Come on.
Hello, everyone. This is Kamal Hashim. I'm professor of ophthalmology. I'm working in anterior segment and cornea and refractive surgery. I used to be on board of the Sudanese Medical Specialization Board for a long time. And I have been also Dean Faculty of Optometry in one of the largest universities in Sudan for about 5 years. And also I took the post of president of that university for 4 years also. Now I'm working in Sudan Eye Center in Dongola. Thank you.
Thank you very much. So we are going to kickstart things with a short presentation from Nicola. So Nicola, would you like me to share my screen?
Yes, please, Rosie.
1 second. There you go.
Thank you, Rosie. So next slide, please. So our mission for the Ophthalmology Foundation works with eye care professionals and societies, organisations, and our aim is to enhance and provide ophthalmic education with a specific focus on low resources and underserved countries. The Ophthalmology Foundation examinations are more than just written tests, and they're a globally respected benchmark of knowledge and excellence to help ophthalmologists at every stage of their career to demonstrate their expertise, gain recognition, and build the confidence to deliver better care to their patients. Next slide, please. So we have a board of directors. Jim Mazzo is the president, and then we have 3 vice presidents and a secretary treasurer, and then several board members. A lot of them are from the ICO, so they've got experience that have come over to the Ophthalmology Foundation, and then several names in there are from industry, and we rely on industry to help support our many programs. Next slide, please. So we have 4 key program initiatives. We have faculty development, accreditation, fellowships, and examinations that we are going to talk about. These have been running for the 5-year period, and examinations are relatively new, being introduced in the last 18 months. And we believe that this is a process that a trainee can then take the OF exams, then hopefully move on to the fellowships, Then they run a department, faculty development, and then accreditation. So the 4 program initiatives that we are currently running, we hope will all entwine into one smooth process. Next slide, please. So the exams. So why run these exams is because there are several critical purposes. They set and maintain high standards in ophthalmology across the globe. They benchmark the knowledge of the experts, so that's you, professionals at all levels, support you through your career progression. And most importantly, we believe that these, in turn, the patients receive the best possible care. These exams are conducted twice a year, so we're currently running them in March and September. And they're also in partnership with the Wills Eye Institute in Philadelphia, which is one of the oldest and prestigious eye hospitals in the world, and also the Will Eye Institute in Baltimore. And we're also in discussions currently with the Royal College of Glasgow and the Royal College in Edinburgh. And I'll come on to that in a moment. So next slide, thanks Rosie, next slide. So what we offer, the examinations are structured into 3 sections: visual optics, refraction and clinical ophthalmology, all use single best answer format. And you'll be pleased to know that there's a correct point for each correct, 1 point for each correct answer and no negative marking. We also offer exemptions from the visual optics for eligible candidates. So those of you that have passed an ICO exam, for example, or a COEX exam, visual and optics, will be exempt from the OF visual and optics. So we're not asking you to repeat anything that you've already done, and then you'll be able to move on to the clinical exam. The exams are mapped to the BCSE curriculum, and we provide suggested reading lists and materials via our website. I'm pleased to say also that we're collaborating with Cybersight to create a dedicated preparation portal that we hope will then support you further. Our exams are criterion referenced, and we use an ANGOF method of standard setting, and that's with a pool of international question writers and standard setters. And we also have the David and Molly Pyatt Travel Award, and that's for the top passing candidate across both sittings of the clinical exam, and that's $10,000 US, and that's for the top passing candidate to use as they see fit. And I had the pleasure of telling our successful candidate this year, who was actually trained in Ethiopia and took the exam in Rwanda, that they had achieved the top passing mark. And he has decided to use the $10,000 to travel to the American Academy next year, and then also add some time on afterwards to do some study and fellowship program. Next slide, please. So obviously you're taking lots of exams within your normal system, and you may look to take an international exam. So what are the benefits? The benefits of our exams are quite significant. So they're internationally recognised, yet cost less than any comparable exams, and can be taken in your own country. So we say that we bring the exams to you. So if you're in a remote part of the world, we say that let us know where you are, and then we can bring the exams to you. And what that means is that you don't incur any travel costs, any hotel accommodation. So we're trying to be as flexible as possible. And I'm pleased to say that over March and September this year, everyone that requested to take an exam in a particular region, even though it was remote, some of them, we actually was able to accommodate them. And we also scale our fees based on the World Bank Index, so that makes them accessible and fair for all of you. And then candidates can earn points towards an IOF fellowship application each year. And as I mentioned, the highest passing candidate is eligible for the David and Molly Pyatt Award. And passing earns FIOF, so the Fellow of the International Ophthalmology Foundation title. And if you're hosting the exam, then you can join our global community, benchmark your own trainees, and you also receive the honorary FIOF, which lasts for 5 years of hosting and then becomes permanent. And again, overall, we're hoping this improves the quality of eye care that you provide to your patients. Next slide, please. As I mentioned before, we have visual, optics, and clinical. Visuals 120 questions, optics 60 questions, clinical 160 questions. They're mapped to the BCSE, and the exams are conducted fully online. So Richard's going to talk about the clinical in a moment, but this is just an example of our visual sciences question. We're not here to test English language. You're not here to test your language. We're here to test knowledge. So you will see, for example, the questions are quite similar throughout. So we use more often than not regarding, and this one's regarding the blood of the retina barrier. And then we say which one of the following statements is most likely to be true. And so this is a common format that we use throughout the 3 papers. We also then have them in alphabetical order, as you see down the side, A, B, C, and D, so 4 stems, and they are alphabetical order. Again, we're not testing language, we're testing your knowledge, and this kind of makes it slightly easier when reading a question and trying to look for the correct answer when they are in alphabetical order. Next slide, please. Again, same with optics, which one of the following? And then if we move on to clinical, and Richard will talk about clinical in a moment, we also have pictures. Going forward, we hope to have videos. We'll have graphs, templates, tables, and again, as you can see, A to D is in alphabetical order. Next slide, please. So we also are not a membership organisation, but our impact is strengthened by our partnerships, and we're pleased to say that we're working with you as a team in Sudan. We work with prestigious organisations like yourself all over, including the Wilmer and the Will Institutes that I've mentioned. We're also working with the African Society of Ophthalmology, COEXA, the Pan America, and we're also working with lots of young ophthalmic societies. So the Young Ophthalmic Society in India, and also the West Indies. We're also building strong and new relationships. So we've signed lots of MOUs, memorandums of understanding, in partnership with societies for Turkish, the Mongolian, Nigerian, and Indian societies. And we're also continuously seeking new collaborations with societies and organisations. And what that does, it further strengthens our global reach and impact. And also that helps our trainees then have a global reach as well through our exam portal and our partnerships. I think this is relevant and it builds a stronger global ophthalmic community. I'd just like to say as well a bit about our committee. At the heart of our exams is our International Exams Committee with members from all over the world. And what that does, it ensures exams remain globally relevant and fair. And as I mentioned, they standard setting using the ANGOF. Exams are marked online, so all exams are taken online, and the results are released within 2 weeks, which is a testament to our team. Rosie and Vicky managed to get the results out within 8 days of taking the exam, and I think that's quite an important part of the process, because there's nothing more worrying if you've taken the exam and you're waiting for those results. And some exam boards leave you for a month or 2 months to wait for the results, but you'll get the results from the OF exams within 14 days, if not less. I think the slide before, Rosie, if you wouldn't mind, sorry, we've had lots of positive feedback. Some of the candidate experiences you can see here, and we have lots of testimonials that go out on our social media and also on our website. They've already made a difference, these exams, to many candidates in dozens of countries, and we hope what they'll do is advance your career and raise eye care standard. As one candidate I met in the American Academy this year said that passing this exam's opened doors they never thought was possible, and they took the exams and are moving on through the fellowship program, like I spoke about earlier. And for them, that's really important within their area of expertise and what they're currently doing. And we're always got ambitious plans. We aim to reduce costs of the exams even further. As I say, they're one of the lowest exam costs. And that's not because they're not valuable, it's because our aim is not to make a surplus and make a profit. We want to put the money back in to lowering costs and also increasing the number of fellowships we offer. I think our reach is getting further, so that's what we're aiming for. And also we're adding subspecialty exams from September 2026. So we're looking to introduce retina and glaucoma. I think it's important to say that we listen to our trainees and our candidates and our colleagues. So if you have any feedback or ideas, what you'd like to see in the future, if you'd like us to run a different subspecialty, for example, then please let us know. Your input helps us continue to evolve and improve. And as I say, we're very much a partnership. I think the next slide, Rosie, shows our QR code, which you'll get some more information on. And obviously, Richard and our colleagues are going to talk further. But I think, in summary, the Ophthalmology Foundation, at the heart of what we stand for, is setting up and upholding the highest standards in ophthalmology. And I think that's empowering to you as professionals to grow and improve outcomes for the patients around the world. I think every candidate who takes our exams becomes part of our what we call our global community, and committed to eye care. So I think I'm very proud of what these exams achieved so far. And I think we're, as a team, are determined to make them even more accessible, relevant and impactful in the years ahead to you, and hope that you are happy and move through the system to achieve the accreditation in the end. So thanks very much for listening. If you've got any questions, then just pop them on or ask. And yeah, hopefully we'll see your application form in the future.
Thank you for that, Nicola. I'm just going to pass you over now to Richard Bowman. Richard, I believe you have something prepared as well.
Share. Doesn't seem to want to share my screen.
I've just made you a co-host, Richard, so perhaps you should be able to share it now.
Right. Here we go. Okay, can you see that?
Yeah.
Okay, so I'm just going to talk briefly about the clinical exam. That's not advancing. There we go. And it's 160 multiple choice questions with a single best answer. Say, and again, the wording will be similar for each one. Which one of the following is most likely to be true or most likely to be the correct diagnosis? So the format of the language is similar. There may be some answers that could be true but are less true than the best answer. So you're looking for the single best answer. As Nicola has said, for the other exams, each correct answer gains 1 mark and there's no negative marking or penalty for guessing. So blanks receive 0, as do incorrect answers. And these are the subspecialty divisions, just to give you an idea. And we take the American Academy syllabus as a rough kind of guideline. And the standard we're looking for is kind of similar to other postgraduate exams. So a trainee with reasonable clinical experience, as well as book knowledge in these subspecialty areas. And for each of them, we are trying to test whether you've had some clinical experience and whether you know how to apply the knowledge that you've gained by reading. So I was going to show you a couple of questions to show how we try to test secondary level knowledge as opposed to just primary level knowledge. I think these two questions are at the harder end of the spectrum, actually, so I don't want to put you off, but the Leber's hereditary optic neuropathy, hopefully most of you know about that. It's quite a rare condition that causes optic nerve disease. And here's a question that you could answer if you'd read about it. It's most likely to present in which of the following ways. So that's and the answer is B, sudden sequential severe visual loss in young people. They tend to go blind in one eye and then a month or two later blind in the other eye. And you could know that from reading, but if we want to test you as clinicians, we might be more tempted to give you a clinical scenario. So a young man presents with sudden onset visual loss in the right eye, slightly hyperemic disc, no RAPD because Leber's tends to be pupil sparing, and then 3 months later the same thing happens in the left eye. Which one is the most likely diagnosis? So we've turned it around. We've given you a clinical scenario, so that's closer to what you face in real life to see if you can make the differential diagnosis. And this is an example where actually any of these could be true, but it'd be extremely unlikely to get non-arteritic AION in a young person. Is extremely rare. Multiple sclerosis, the vision tends to get better. So with no visual recovery, Leber's is more likely. And neuromyelitis optica tends not to present with that sequential visual loss like that. So we're going a bit more clinical there. And then if we're trying to test your knowledge further, same patient, same disease, but we're asking you to think about the genetic implications because Leber's is an unusual disease in that it's involves a mutation in the mitochondrial genetics, so it's inherited from the mother. And also it tends to affect men more than women. So this is asking you to diagnose the clinical scenario as Leber's and know that this is inherited from his mother, but it's more likely to affect his mother's brother than the mother because boys are more affected. So same disease, three different questions. One's kind of straight out of a book. One's testing your clinical differential diagnosis. And the third one is testing you further to see if you can understand and apply the genetics of the disease. Here's another question, which is a fluorescein angiogram showing peripheral closure of the blood vessels, which is fairly obvious. And there are a number of diseases that might present like that, but the clinical scenario is again asking you to think laterally. Why would you do a fluorescein angiogram in an 18-month-old girl? We don't do these very often. And the answer is a condition called incontinentia pigmenti, which is a recessive disease that causes this appearance in the retina and presents with a pigmentary skin rash. Best disease doesn't look anything like this. It presents in older young people. Retinopathy of prematurity. Again, this is just a good test of your clinical experience because if you did a fluorescein angiogram of ROP, it would look like that, but we never investigate premature babies with fluorescein. We just rely on clinical findings. And again, you'd never do a fluorescein angiogram for unexplained poor vision. So again, we're looking to see if you know what investigations you'd use in what situations there. However, I have to say those are both quite rare diseases. and I picked them out more to show you that we're trying to test your application of knowledge, not just your knowledge. I've got one more question here. It's not advancing again. There we go. This is just to remind you that there is this community and public health section, which, you know, certainly when I was training in ophthalmology, I was probably less knowledgeable about that than the clinical side of things. So it's worth just revising some basic numbers of, you know, global burden of blindness, which conditions cause the biggest burden of blindness and visual impairment, and have some rough idea of numbers, because there are 10 marks on that. And it won't all be numbers like this, but you can pick up some easy marks by having these, having revised these figures. And just to say, in terms of the quality of the questions and how we try to make this exam fair, for each question we try and calculate after multiple attempts how reliable the question is. So whether candidates who score highly overall are likely to get an individual question right, or whether the question's an outlier and candidates who do well overall may not be likely to get that question at all right. And that might be because perhaps it's on global blindness and not many ophthalmologists know about that, and they should do. It might be that, or it might be that it's a bad question, and it's not a reliable question. So we try to make the exam fair, not just by having clinicians setting the papers, and obviously they're checked by numerous other clinicians once they've been set and often edited, but then we look at how they perform in different exam situations to see if they're discriminatory of candidates who have a good level of knowledge and application. And yeah, so each question goes through that kind of test. So that's it from me. Thanks very much. Happy to take questions.
Thanks very much, Richard. We'll have questions at the end, I'm sure, that we may be pinging your way. But for now, Dr. Ahmed and Professor Kamal, if you have anything that you were wanting to share before we head into the Q&A section.
I will be starting by shedding some light on our local training context, and to speak about how it is important for our junior colleagues to join OF. So for our local training context, the Sudan Medical Specialization Board, it was established in 1995. It is currently the sole national body catering for postgraduate medical education. In the past, universities used to give training for postgraduate medical doctors, but now the only body doing that is the board, the medical board. University of Khartoum started postgraduate in early 70s, and the master's degree in ophthalmology was the first specialization done at that time, and other specialties followed. But Sudanese historically used to prefer to go to UK to get fellowships from royal colleges, and they are still so far they prefer UK certificates and postgraduate studies. Today, there is approximately 250 candidates enrolled in MD program in Sudan, and already over 1,000 were graduated from the board since its inception in 1995. Sudan actually witnessed a good development in ophthalmology, starting from late 90s up to the start of the war. And we used to have very good settings in our hospitals, the private sector and the non-governmental sector and the governmental sector. And the training was really good, and we could attract candidates from neighboring countries to come and train in Sudan. But unfortunately, the war has devastated what we have done through years, and now we need to work very hard to regain what we have lost due to the war. I think IOF represents, or IOF exams represents an excellent opportunity for further strengthening and enriching our local ophthalmology training in Sudan. And I think that will encourage people to attain higher levels of knowledge, higher levels of application of their knowledge in clinical practice, to be able to pass such international exams and to attain an international standard. For that, I really encourage our junior colleagues to join these exams, because OF, in collaboration with globally renowned institutes such as Wills Eye Hospital and Wilmer Eye Institute of Johns Hopkins, which are, as you know, are the two leading centers of excellence in ophthalmology in the world. This will offer invaluable pathway for our residents and young ophthalmologists to pursue further development of their career in different subspecialties. And I need not to say or to speak about the importance of having subspecialties these days, because it is becoming a mandatory in our practice. It will continue to be so in the future. So I really encourage our junior colleagues to join OF exams, because that will open the ways for joining fellowships opportunities. In last September, Sudan Eye Center proudly hosted the first OF examination in Sudan. The process ran very smoothly, thanks to Ahmed, the coordinator, and candidate feedback was overwhelmingly positive. Although the number was, as expected for the first exam, was small, but the feedback was really very positive. And I think the exam provides significant opportunity to deepen theoretical knowledge and enhance practical clinical decision making, and increase eligibility for IOFF fellowships. For all that, I confidently and strongly encourage our junior colleagues to join OF exams, and I wish good luck to all of them. Thank you very much. That's all for me. I think Ahmed has something to add.
Yes. I think all the points have been covered, but I just want to add two other points regarding the registration. The first one is about the payment. We are struggling here in Sudan with the online payments, so the foundation has kindly provided a solution. So anyone who can't pay online can pay in cash to us at Sudan Eye Center, and we will complete the payment on their behalf. And maybe later, Vicky will walk us through the exact steps on the online application for choosing this method. The other point is the venue. As for now, Dongula is the main exam center, but we can also host the exam in other cities, provided that the candidates register, provided that enough candidates register. For example, Port Sudan, Khartoum, Omdurman, or Medani. Yes, and that's all. And we look forward to supporting all candidates in the upcoming exam cycle. Thank you very much.
Thank you both. Thank you both very much for that. Vicky, I'm going to hand it over to you now as we enter into the Q&A portion of the webinar. And if anyone has any questions as we go, please feel free to drop them into the box at the bottom of the screen.
Thank you, Rosie. So the first question is, what are the payment options?
So, so you can pay through the online portal. You can use a credit card or a debit card. Alternatively, if you're finding that difficult to do, then you can select I think it's sponsor in the online portal, and that takes you through to the next stage without you making payment. And then just email us and we will send you the bank details. Alternatively, you can then make payment in cash to your centre, and then they will submit it over. I'd just like to add as well that we have introduced an online payment system, a three-way payment system, which means that when you apply, you make a third of the payment. And then subsequent to that, you'll get notified the month after and then the following month for the additional two payments that cover the total cost of the exam. And I think we're finding a lot of candidates, trainees applying through that system. It's a lot of money, isn't it, when you to add on to your everyday outgoings and commitments. So we understand that. So if you can split it over the 3 month period before taking the exam, then we felt that that would be helpful to trainees. So that's up and running. You can find it on the online portal, and I think so far we've had about 20 go through that process. So it's working well.
Thank you. The next question is there an age limit for fellowships or the examinations?
No, so well, there isn't for exams, so you can take it up to any age. And actually, we've recently had a ophthalmologist from Denmark who has fully qualified, is acting independently, and has decided he wants to benchmark himself against the rest of the world. So he's taking the clinical exam. For fellowships, there is an age limit of 40. I think with that kind of process, there has to be some kind of age limit. But equally, I think, if you're sitting at 42, 43, and you are looking to take a fellowship and it's going to benefit your institute when you go back, and it is going to be fruitful for both parties, then I think, of course, you should apply. You should at least email Cordula Obermeyer, who's in charge of the Ophthalmology Foundation IOF fellowships, and get her opinion on it, because we don't want to tell you to be age discriminatory, but equally, there has to be some limit. But again, I think you should ask the question. I don't think you should be put off by that necessarily.
Thank you. We have a question for Richard. What are the topics within the clinical examination?
Switch my thing. Let me try and share again, and I'll put the slide up. Can you see that?
Yes, we can.
Yes.
So, does that slide answer the question for the person who asked it, or are you wanting to know some more detail? Can we ask?
Yeah, I think that's great. Thank you very much.
Okay.
Then for Nicola, how do they prepare for the examination? What would the revision time be, and what sort of material would they use to revise?
So on our website, we have a suggested reading list that contains free websites. I think there's a good video on there and details of a glaucoma procedure. And then they also use that, and then note that the exams are mapped to the BCSE. And we're not suggesting that you go and buy and purchase the BCSE because it's expensive. But I think the suggested reading list is put together by our specialists and relates to the BCSE. So I think that that's a good starting point. I also think we're going to introduce the cyber site, and the cyber site is a great tool for different programs and help you through your training cycle anyway. So I think you should be accessing cyber site, which is also free. And in 6 months' time, we'll have a portal on there as well that will link directly to our exams. I think there's study groups. You can set up your own study group. I think it's good to connect. We can connect you with others that have taken the exam and reach out. I mean, there's a list of people, successful candidates on the website. So feel free to reach out to us, reach out to them. And I think, if you're preparing for an exam, I think you have to look at your own circumstances. Do you feel confident? What part of training are you in? and we recommend that you take the visual and optics in your first, second year of training, the clinical in your third, fourth year of training. Again, only a recommendation, but how confident are you? Some are very confident and go on to be successful. So I think that you need to take that to account as well. And I think also, taking a step back from exams and looking at as just a human being. I think you need to look at where you are in your life and what other commitments you have going on. Again, this is an exam that may not be essential to your actual program, maybe something you choose to do. But if you've got other commitments and the times after Christmas is not right for you, then we run the next one in September, and it may be the right time. And if you've got young children and work and hobbies and that, it can be quite difficult. So I think, as well, don't not put too much pressure on yourself. Take a step back and just evaluate everything from where you are. But in roughly 3 months, I think, of preparation.
Thank you. Can a candidate sit all three examinations in one sitting?
Yeah, and I think we would have to check with the centre. But I think it's possible. From experience working with other organisations, the statistics show that if you take all three exams on the same day, the success rate of that is much lower. So I think if you take most trainees take the visual and optics, and then if you're successful in one and not the other, and let's hope you're successful in both, but if it doesn't work out that way, then the next sitting you could potentially take the one that you weren't successful in, and the clinical. So again, I think it depends on how confident you are. But it is a long period to sit for exams. It's a long period to concentrate. It's a long period to prep for. So recommendation would be that you take visual and optics first. We do offer an exemption policy, as I said. So if you've passed the ICO exams, visual and optics, you don't have to sit our visual and optics. So keep that in mind. And if in doubt, then obviously email us. But yeah, I would recommend that you take the vision and optics first or the clinical and optics. I wouldn't recommend taking all three, but again, it is preference.
Thank you. Is there any exemptions available?
Yes, so if you've taken the ICO Vision and Optics before and including 2022, you're exempt from the OF Visual and Optics. I think if you've passed the COEXA exams, Visual and Optics, again, you're exempt from the OF Vision and Optics. And we also take into consideration any of the UK exams, so Royal Physicians and Surgeons of Glasgow, Surgeons of Edinburgh, and the Royal College of Ophthalmology exams will exempt you from the Vision and Optics. And I think it's quite important. We're not asking you to retake and prove that of what you've already passed. We are very much that recognizing other exams and that you've been successful. So if I've not listed one that you got on your radar that you think am I exempt, then obviously drop us an email and we'll let you know. But I think a lot of people have taken the ICO exams and have been successful in visual and optics, and you can move directly onto our clinical.
Well, lots of people have asked this one. Is this the same as the ICO? Is this the same
No, it's
organisation?
better. It's better than the ICO. One, it's cheaper than the ICO. Two, a lot of the people from the ICO migrated over to the Ophthalmology Foundation. So we come with years and years of experience now, with international exams. There are more fellowships in conjunction with the Ophthalmology Foundation. So you apply, you've got more chance of being successful in an IOF fellowship. We know the standard is high. We have several members of our committee, international members, that sit on the boards of the EBO, the Royal College of Ophthalmologists, the COEXA. So we know our exams are of a particular standard, and a high standard. So yes, are we the same organisation as the ICO? No, we're similar, but we're better. And a lot of people have migrated over from the ICO to the Ophthalmology Foundation, and also we've used new blood. We have new blood. So yeah, my answer would be better.
Thank you. What are the fees for Sudanese candidates?
Do you have those in front of you, Vicky? I don't have them in front. I'm sorry.
Yes. So for visual science, it's $125. The optics, refraction, and instruments exam is $100, and the clinical ophthalmology exam is $175. Next question is, there's a candidate from Sudan who's now living in Rwanda. Are they able to take their exam in Rwanda, or do they have to come back?
No, you don't have to come back. And we're very much about reducing costs. So not only are our fees reduced, as I said, we have many centres around the world that you can attend. So you can take it in Rwanda. Chiki Muthinge is actually in charge of the centre in Rwanda, and I know her personally. So I guarantee she'll take you in that centre. I think also what that does is it limits, reduces your costs. So you've got no hotel costs, hopefully, you've got no travel costs, you don't have to go back home and take it. And I think that's important as well, because obviously, everyone's got commitments. And the more we can help out with that, the better. So, yeah, if you want to take it somewhere else, then please let us know. And if you go online and you don't see send a location that you'd like, then obviously email us and we'll do our best to accommodate that. And we've been 100% successful this year in March and September sitting. If you couldn't see a centre that you wanted, we have managed to find a centre for you. So that's reduced totally zero travel costs for everyone.
Thank you. Are the examinations required to gain a fellowship?
They're not at the moment, and that's a really good question. So what happens is, and what we say here in the UK is that the more points you get, the more prizes you get. So actually, if you pass one of our exams, you are awarded points for each of those exams, and those points go towards your application for an IELTS fellowship. It's not mandatory to take our exams now. You do get points for other exams, albeit they're a slightly reduced number than what you would do if you passed our exams. But I think going forward, there is discussion about making the OF exams mandatory for obtaining a fellowship, and that's for obvious reasons. But I think you need to just keep that in mind. I think the earlier you apply for these exams, then the better.
Thank you. What are the benefits of taking the Ophthalmology Foundation examinations, and what can passing all of them gain a candidate?
You get the postnormal FIOF, Fellow of the International Ophthalmology Foundation. You are internationally recognized. You can apply for a fellowship and you've got more chance of obtaining a fellowship. I think you can benchmark yourself against international trainees. Your institute can benchmark against others in your institution. And I think it makes you stand out from the rest. I think in turn as well, yourself, it gives you confidence knowing that you're treating your patients to the highest possible standard. And that is what our aim is. Our aim is to raise the standard of eye care worldwide. And I think by passing these exams, you should be proud that you have and achieved the score and put your certificate up so that everyone can see. I think as well, passing the clinical exam, you have the opportunity of receiving the David and Molly Pyatt Award. And that again is $10,000 US. And so the clinical exam over the two sittings, March and September, you have a chance of being successful. And we do offer merit and distinction awards as well. So I think, it's something you should be really proud of if you achieve.
Thank you. A question for Dr. Ahmed. How can a candidate who doesn't have a Visa card contact you to make payment for the exam?
They can contact me directly, and I can arrange the collection of money. Yes, and then we will pay on their behalf.
Thank you very much. I'm going to take his name down so I can email them your contact details after the webinar. Great. Richard, a question for you, which is a random question from the webinar. Is there one common question which is repeated every time in the clinical exam?
No, we do to try and maintain a consistent standard. We recirculate about 15% of questions each year. Well, sorry, each time the exam is taken, just to get, and as I mentioned, we tend to select higher performing questions. So there's a small amount of repetition, but there's no one question that comes up every time.
Thank you. Nicola, do we have a syllabus available?
Sorry, you cut out.
Do we have a syllabus available?
There is a syllabus linked online to our website. So yes, and as I say, the questions are mapped to the BCSC. And yeah, the syllabus is available on the website. But if you can't find it, then just email us and we'll send that through.
Great. This is a question. One second. If a candidate has moved to a different country, a higher rated country, what fee would they pay? Their home country fee or the country where they live and they wish to take the exam?
I think you would need to email us and let us know how long you've residing there, if it's permanent or if you're going back to your place of birth. I think we have to look at each individual case, and I can't categorically say this is what you would pay. So yeah, let me know if you email me, then I'll have a look at it for you.
Thank you. And that was for Ella in the Q&A box. Do we have any subspecialty on the horizon?
Yes, we are going to introduce subspecialty, and thank you for the question. That will be starting in September 2026. We've had a look at the subjects, and I think we're going to start with retina and glaucoma, so two subspecialty exams. I believe they're going to be about 120 questions over a 3 hour period. And then we will start then moving forward with those and introduce two more in the March 2027. And so it's a gradual process. I think the most popular ones are going to be introduced first, and then we'll move through introducing them.
Thank you. This is a fellowship question, so maybe we may have to pass them on to Cordula. But is the fellowships fully funded, or do students have to pay a fee?
No, they're fully funded. The 3 month fellowship and the 6 month fellowship are fully funded. I think up the 3 months is up to $6,500, I believe. Best person to talk to is Cordula. She's 100% better than I am, but I think they are fully funded, and I think that covers, your flights, your accommodation, and your cost of living. I think it's mindful though that you keep in note where you'd like to go. Obviously, $6,500 is the value of that is different in each region. So I think if you're going to India, then I think you can find good accommodation, etc. for that. But I think if you're going in the middle of New York, for example, then I think that may not last, and you have to kind of be mindful of that. I also think a lot of our fellowships are observerships, and that will depend again where you go. So what I would suggest is that you download the application form if you're thinking of applying. Make sure that you read it thoroughly. Look on the website, contact Cordula, contact us, mainly Cordula for fellowships, but if we can help, we will. And get as much information as you can before you apply.
Thank you. I think we have just one more question left. Oh, the last question is very easy. How many times is the exam in 1 year? How many times can they retake in 1 year?
You can take it as many times as you like, actually. There's no limit. So, look, we hope you're successful in your first attempt. If you're not, try and not be disappointed. We've got a great article out. I think it's available via the website, of trainees that have been unsuccessful. And I think it's it is disappointing, but I think you have to take what you can from it and be positive that you will actually achieve the mark. So you can retake it as many times as you need to retake it. You can take it in the same year. You can leave it a sitting and take it in the following year. But at the moment, there's no limit. And I don't believe we will put a limit on that.
Thank you. So if a candidate was to have been unsuccessful in March, they can resit again in September, yes?
Yes, that's correct.
Thank you very much. Rosie, we're out of questions. Thank you.
Great. Thank you, Vicky. And thank
Sorry,
you,
one more
everyone.
question. Sorry, one question's just come in. How many exams would you suggest them take with the Ophthalmology Foundation before they apply for a fellowship to give them the best preparation?
Interesting question. I think it also depends on what other exams you've taken. I think, again, the more points you have towards an application, then the more chance you have of being selected. But I think the exams are not essential for applying for a fellowship. I think it's personal choice. So I think I would say, if you're your vision and optics are recommended in your first, second year of training. I think that's kind of where the point you'd be after that for applying for a fellowship and being confident enough of a fellowship. So I would recommend vision and optics, but not essential if you choose to go down a different route. At the moment, as I said, going forward, I think they will be mandatory.
Thank you very much. That's all done, Rosie. Thank you.
Great. And thank you. Thank you to all our panelists. And thank you so much to everyone who's come today and attended this webinar. We will be sending you out a link to the recording. So you'll have that soon. It'll be on our YouTube page. And as always, you can email our team or reach out to us via social media at any point. So we will send you all of our information. And thank you very much. I hope everyone has a lovely evening and we will speak to you soon.